Wisteria Home Care Agency Training Video Tuberculosis, TB, Infectious Control Policy. Welcome to the Wisteria Home Care Agency's Training on Tuberculosis, TB, Infectious Control. In this video, we will cover the essential aspects of our TB control policy, including procedures, responsibilities, and best practices to ensure the safety of our staff and patients. At Wisteria Home Care Agency, our priority is to maintain a safe environment for both our patients and staff. We adhere strictly to OSHA standards and CDC guidelines for tuberculosis infection control. Let's dive into our TB infectious control policy. Purpose: our TB infection control plan is designed to manage Mycobacterium tuberculosis and minimize the risk of exposure and transmission. This plan is readily available for all staff to review. Definitions and risk levels. We categorize our risk levels to tailor our infection control measures effectively. Very low risk. We do not admit patients with active TB and refer potential cases to collaborative agencies. Minimal risk. We provide services to areas with no reported TB cases in the previous year. Low risk. We care for fewer than 3 TB patients per year and monitor conversion rates without detected person-to-person transmission. Intermediate risk. We care for 3 or more TB patients per year with consistent conversion rates and no detected transmission clusters. High risk. Significant increase in PPD test conversions or evidence of ongoing TB transmission within the agency. Procedures and responsibilities. 1. Administration. The agency administrator or designee is responsible for implementing this plan. 2. Testing and screening. All field staff with patient contact must undergo a 2-step MAN2 PPD test upon hire, followed by an annual TB questionnaire. Positive MAN2 PPD results require a chest X-ray and ongoing assessments. Staff with positive results will be evaluated for symptoms and required to obtain a chest X-ray if symptoms develop. Patient and staff management. Patients with TB symptoms. Immediate notification to the patient's physician and local health department if TB is suspected or confirmed. Staff with TB, staff with positive PPD results must obtain a chest X-ray and may need to be excluded from work until cleared. Annual TB testing and evaluation are required. Care of patients with TB, early identification. Look for symptoms like productive cough, weight loss, and night sweats. Precautions. Patients should cover coughs and sneezes. Use of approved particulate respirators is essential when caring for TB patients. Isolate TB patients in well-ventilated areas when possible. Cleaning and disinfection. Sterilization. Critical items, for example, needles, must be sterilized. Semi-critical items, such as stethoscopes, should be cleaned with high-level disinfectants. Non-critical items, like crutches, need only low-level disinfectants. Respiratory protection. First, let's talk about fit testing. All staff exposed to TB or airborne hazards must be fit tested for HEPA respirators. Next, the selection process. It's important to use NIOSH-approved N95 respirators or something similar for TB protection. Finally, training. Staff will receive education on the use, maintenance, and limitations of respiratory protective devices. Fit testing protocol. Types of fit tests include qualitative QLFT and quantitative QNFT tests, which ensure a proper fit of respirators. Fit testing is required before initial use annually or when facial changes occur. User seal check. Always perform a seal check before entering a patient's home or room to ensure your respirator is properly fitted. Summary. Remember, effective TB control is vital to protect our patients and staff. Follow these guidelines to ensure we maintain a safe and healthy environment. Thank you for your attention and commitment to TB infection control. For any questions or further information, please refer to the full policy document or contact your supervisor. Stay safe and continue providing excellent care. This concludes our training. We appreciate your dedication to keeping our workplace safe and healthy.